Decreasing physical protest behavior by increasing coping and relaxation skills. The client is an 8-year-old male diagnosed with ASD. The client was diagnosed with autism spectrum disorders by the Child and Family Clinic on their military base at the age of 8 years old. Previously, the client attended the first grade in a regular setting classroom. His physical protest behavior was consistent, affecting his day-to-day activities and social interactions. Currently, the client is being homeschooled. He is now in 3rd grade. The client receives one-on-one ABA therapy Tuesday through Friday from 1 to 3 p.m. in the home. He was referred to increase social skills, functional communication skills, coping skills, and to decrease physical protest behavior. The client has been receiving services for 3 months. The client's physical protest behavior impedes him from successfully participating in social interactions with the family and peers. Although the client has excellent receptive and expressive language skills, he struggles to communicate when feeling upset and frustrated. In addition, he is not able to engage in relaxation and coping skills. Physical protest behavior is defined as an instance of showing frustration by grunting, whining, and clenching his fists and teeth. The client will then scream in a high-pitched sound, cry and kick, punch the individual, or push the individual in the back with a closed fist. He will also threaten to hit the individual with objects in his environment. The onset of the behavior is when the client engages on any of these topographies listed above. The opposite of the behavior is when the client is void of any of the above-mentioned behaviors for 10 consecutive seconds. Sessions took place 4 days per week for 2 hours in the home and in the community. Natural environment was used to implement interventions and address problem behavior. Physical protest behavior was measured by partial interval data. During a typical 2-hour session, data was taken on the frequency of the behavior taking place in 30-minute intervals. There was a total of 4 intervals in a 2-hour session. Data was taken by therapists and by parents. An ABA-B design was utilized in this intervention during the initial baseline, the reversal to baseline. The frequency and the physical protest behavior was used as well as different reinforcement procedures. They were consistent in the delivery or removal of the consequence contingent to the client's appropriate and inappropriate behavior, and functional communication training was implemented. Program 1, Coping Skills. Baseline data for this program was taken in the first 10 opportunities to identify relaxation techniques that would be more effective for the client. Client engages in coping skills independently in 6 out of the 10 opportunities. Program 2, the 5-point scale. Baseline data for this program was taken in the first 10 opportunities to identify the client's understanding of the 5-point scale emotions: happy, sad, upset, mad, or angry, and being able to respond to verbal prompts. How do you feel and what can we do? Client engaged in using the 5-point scale independently in 7 out of 10 opportunities. Program 3, Relaxation Skills. Baseline data for this program was taken in the first 10 opportunities on identifying relaxation techniques for the client to engage in. Client engaged in relaxation techniques independently in 3 out of 10 opportunities. During baseline data condition 1 for intervention with the 5-point scale, physical protest behavior took place 20 times and duration was between 4 and 7 minutes. During baseline data condition 2, the intervention with the 5-point scale, physical protest behavior took place 12 times and duration was between 2 to 4 minutes. During baseline condition 1 for intervention during differential reinforcement for an alternative behavior, physical protest behavior took place 18 times, and for baseline condition 2, physical protest behavior took place 16 times. During baseline condition 1 for functional communication training, physical protest behavior took place 16 times, and for baseline condition 2, physical protest behavior took place 9 times. Physical protest behavior took place during PE when working on difficult tasks and when denied or access to a preferred item or activity. During the treatment phase for all interventions, physical protest behavior increased once the intervention was implemented by the therapist and parents. For the 5-point scale intervention, baseline condition 1, the IOA was 75%. Treatment condition 1, the IOA was 88%. Baseline condition 2, the IOA was 92%. Treatment condition 2, the IOA was 100%. For differential reinforcement of alternative behavior, intervention baseline condition 1, the IOA was 66%. Treatment condition 1, the IOA was 95%. Baseline condition 2, the IOA was 88%. Treatment condition 2, the IOA was 88%. For functional communication training, baseline condition 1, the IOA was 93%. Treatment condition 1 was 85%. Treatment condition 2, the IOA was 100%, and baseline condition 2, the IOA was 88%. Physical protest behavior showed an increase once the intervention was implemented. We see a decrease in baseline condition 2. Once in the treatment condition 2, the behavior was decreased with the minimal behavior outburst. In this graph, we could see the 5-point scale intervention and how behavior increased in the intervention. The second graph, we could see the differential reinforcement of alternative behavior. For the third graph, we could see functional communication training. All household members will be involved in the learning of the strategies to assist in generalization across people. Naturally occurring routines will be utilized during session time to encourage generalization across activities. Physical protest behavior decrease and coping and relaxation skills increased by implementing the 5-point scale, functional communication training, and differential reinforcement of an alternative behavior. By decreasing the physical protest behavior, the client's social skills as well as daily family interactions increased. For future studies, the training period for family members and parents will be extended in order to have reliability.